Hi guys. Hello, hello. All right, Karen, I sent the invite. You should see it shortly. I don't know. Are you seeing it? It's saying that you're watching. Hey, Mel. Hi, guys. Good afternoon. Good afternoon. Good afternoon. How is everyone doing today? Not sure what is happening here, but I'm waiting on my guests. Uh, there she is. She should be coming shortly. Oh, here she is. It says adding. No, it says connection failed. All right, let's send it again. I'll send it one more time. Not sure. It's probably the Wi-Fi. Send invite. It was just sent again. Let's see the link. Not sure why it's showing on my screen. That is, it says it's adding. All right, you want me to just call you then? So we can just go live. All right, let's just do it on audio then. Since we're already here. I'm gonna go ahead and call you. It's showing on my screen that it's adding, but I'm not sure what's going on. Hello? Yeah, it's saying adding on my screen and it's blinking, but I'm not sure. So let's just do it on audio. See, it just went off. Um, yeah, it was sent several times, and it came on my screen and it was just saying adding, adding. All right, I'm just gonna put you on. I'm just gonna go ahead and then put the phone on speaker. And we'll go ahead. Pardon me? Yeah, man. I'm just gonna put the phone on speaker here. All right, hold on. Okay, guys. Sorry for that. I don't know. We're having some kind of technical issues here today. However, we will continue. So, of course, I am Marcia Gordon, owner of Marcia's Healthcare Registry and administrator, where care is all you need. We hire HHA, CNAs, LPNs, and RN. Give us a call to take care of your loved one. Our numbers are 954-816-2170. Today is Health and Wellness Thursday, and of course, it's Breast Cancer Awareness Month. And we'll be talking with Dr. Karen Lewis today. She'll share some information with us. And thanks again for joining our live today. Go ahead, Dr. Karen.
Okay, good afternoon, everyone. As Ms. Marcia said, this month is Breast Cancer Awareness Month. And so we're going to be talking about breast cancer. And apart from skin cancer, breast cancer is basically the most common form of cancer.
Okay.
Among American women. And it's the leading cause of cancer deaths in women 20 to 59 years old. In fact, 1 in 8 women living in the U.S. will be diagnosed with breast cancer in their lifetime.
Wow.
Okay?
That's a lot. Mm-hmm.
And about 11,000 women are diagnosed with breast cancer every year. So yes, breast cancer is very, very common. So what are your risk factors for getting breast cancer? Being a woman, of course. You're at your increased risk if you're over 55 years.
Mm-hmm.
And we always say women because, in this day and age, we say assigned female at birth, so we say women if you're a woman.
Okay.
Family history of breast cancer, if you have your parents, siblings, or children, or close relatives with breast cancer, you're more likely. Mm-hmm. And so genetics play an important role in getting breast cancer. Women who smoke are at increased risk of different kinds of cancer, and breast cancer is one of them. Alcohol, which is iffy, but drinking a lot of alcohol may increase your risk of breast cancer. Obese persons tend to have an increased risk. If you've had any radiation therapy, especially to your head, neck, or chest, and those people are on hormone replacement therapy, tend to have a higher risk of breast cancer. Mm-hmm. Okay? So, what are the steps for breast cancer? We said that we have a risk. And we said breast cancer is one of the leading causes of death in women 20 to 29 years old. Mm-hmm. So, what do you look for? And every woman is supposed to be able to do her breast self-examination. So you lie on the bed, preferably. If you're going to be examining your right breast, you're going to put your right hand above your head, and you're going to use your left hand, and you're going to gently palpate your breast. Using your fingers, feel around in circles the entire breast. So go from right to left, go around the entire circle, then feel around the nipple, and feel all the way to the sides into the armpit, and you examine the breast. Now, it's best if you know what your breast feels like, ladies. Mm-hmm. Please do this on a regular basis so you know what your breast feels like. You don't have to do it every day, but at least once a month, whenever you remember, just feel your breast. Women who are menstruating, it's best not to do when you're having your periods or just before your periods, because your breast might be a little tender, and so you might not get the full effect of it. But when you're not having your periods, you can feel the breast. Okay, when your period is finished, right, you can feel your breast. Palpate your breast. Know what your breast tissue feel like. Your breast tissue is not smooth. It tends to be a little irregular, but that's normal for you. So if there are any new lumps in the breast, or you feel something that's strange, you know. Not everything in your breast is cancerous, but if you notice that anything in your breast has changed, for example, if you notice that your breast has gotten larger or the shape of it, it looks lopsided, that's an area for concern.
Okay.
If you notice that there's pain in any particular area of your breast, that's an area for concern. If you know that there's a discharge from the nipple, that means blood, not or pus, not milk, that's a reason for concern. Or if there's a lump in the breast or under the arm, so there's a reason for concern. So, but if you don't know what your breast feels like, and you don't know what your breast look like, then you're not going to know if it's changed, if there's a difference, if anything is different. So the best thing for you to do is to know what your breast looks like. If you're going to examine your left breast, you do the same thing. You put your left hand, you lie flat on the bed, you put your left hand over your head, and you use your right hand to gently feel the breast, around the breast, over the where the nipple area is, and then can move a little bit up under the underarm. Okay, and that is how you know what your breast feels like. So if you keep doing that on a regular basis, I mean, it doesn't have to be every day, as I said, nor even every month, but try to do your breast examination, as much as possible. And once you do that, if there's any change, then you will be able to know.
Okay.
So you find that something is different about your breast. What do? You go to your doctor. But then you don't wait until something happens to your breast, because we suggest that women get their mammogram. Okay?
Yes, we do. Yearly, right? Once a year.
Yes. 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 So we recognize that women should get their mammograms, and if they get their mammograms, then this is one of the screening tests that we do for breast cancer. Okay.
Yes.
Remember, not everything, not every cancer has screening tests, but breast cancer is one cancer that we can screen for. So when should a woman start getting her mammogram? Okay, at what age? What age? Do you know what age you should start getting your mammograms?
No.
Okay, so every woman should, at least if she reaches 40, she should start screening for breast cancer. So once a woman reaches age 40, she should be doing her mammogram. Okay?
Yes.
If there's any change in the breast or anything, then you can do it. Or if there's a family history, they might start a little bit earlier, probably 35. But usually it's at the age of 40. That's when they start doing their mammograms. Okay. So women, once you reach 40, you should do your mammogram, and they can, if the mammogram is normal, they don't necessarily need to get it every year. They can get it every 2 years. But it's up to you and your doctor to decide if you need to get your mammogram yearly or you need to get it every 2 years. Now, sometimes younger people who are 40 might have dense breast tissue. And remember, your mammogram is using radiation to look through your breast. So we're actually looking through the breast tissue. If your breast tissue is dense, you might not be able to see through it very well. Or if there's an area that they might have a little question about, they might want to do an ultrasound. So yes, there are some women who will augment their study, the mammogram, with an ultrasound. But the thing is to work with your physician and see what test they need to do. So if they say, you need to do an ultrasound and a mammogram, then do the ultrasound and the mammogram. If they say you just need to do the mammogram, then do the mammogram. But the thing is that every woman, once she reaches 40, she should be going to her doctor. And if she's been going to her doctor and getting her regular checkup, her doctor will say, it's time for you to get your mammogram. Yes. Okay? So this is a screening test for breast cancer. Okay?
Yes.
So, and everybody knows about the mammogram. Everybody knows what happened with the mammogram, what the tests are, where your cups are turned into saucers.
Mm. A little bit uncomfortable, but we have to do it.
Yes, we don't like it, but it's something that we have to do. We have to do.
Yeah.
Unfortunately, the exact cause of breast cancer is not really known. There are things that increase the risk, as I spoke about before. But the truth is that it doesn't matter, even with the best life, there are women who still get breast cancer. Even with doing everything, they still get breast cancer. So I think the important thing is for you just to do what you can and screen for breast cancer. Okay?
Yes. And men can also get that too, right?
Yes. And the other thing is that men do get breast cancer. So yes, even though women are the ones who are more likely to get it, it's not that men cannot get breast cancer. Okay? So yes, men, look at your body. Everybody needs to look at their body and see what their body is like. Go to your doctor, get your regular checkup, get your regular, examination. The best thing to do is always know your body. Always know your body. If anything changes in your body, you know. So it's much better for everybody. If they know who they are, then they do a better job.
Great.
One second. Hold on.
Okay. We have a commercial break, guys. Thanks for joining the live today, guys. Let's say hello. Hi, Sister Morris. Hi, Brittany. Hi, Winnie. Hi, Sharnette. Mel. Hi, Jennifer. Thanks for joining the live.
Yeah.
Today.
So
Right. Back.
So basically, we have to make sure that as individuals, and not just females, but men and women, we actually know what our bodies look like. Your foot is hurting you, and you go, "Oh my gosh, I've never looked at my." You need to examine yourself, because you need to not let your doctor know what you look like more than you know what you look like. Right. So we have to make sure that we actually know, so there's a change, we can actually identify the change early, and so we can be able to get assistance. Okay? So just a little summary. I think we had some late joiners. We're going to be off soon. Okay. So the summary is that this month is breast cancer awareness, and what we need to do is just to make sure that we actually get our screening done, our mammogram done, as I say, yearly or 2 yearly, depending on what's happening. Decrease our risk factor. If you're a woman, you have a increased risk factor if you're 55 and older. If you're taking hormone replacement, if you have a family history of breast cancer, if you're obese, or if you drink alcohol or you smoke, then your risk factor for breast cancer increases. And so the best thing for us to do is to make sure that we try as well as to prevent these illnesses. And how do we prevent them? We have a healthy lifestyle, we eat properly, we sleep properly, we rest, we exercise, and we get our mammograms done as soon as we reach 40. Awesome. Thank you so much. Anyone have any questions in the chat? If there's no question, we're going to say goodbye for now. Let's see, any question, guys? Okay. Hi, Sister Marcy. She's saying hi to Bert. Okay. All right. Well, remember, the key to a healthy life is having a healthy mind. Thanks for joining us today. And please like, share,
and follow us on Facebook, IG, and YouTube. Thanks again, everyone, for joining the live today, and see you next Thursday, where we continue the talk about breast cancer awareness. Do have a lovely day, everyone. Bye for now. God bless. And thanks again, everyone, for joining the live. Bye bye.